I would now invite Professor Dr. Alain Labrique. May I now invite Professor Alain Labrique, who is a director for mHealth at Johns Hopkins University. He is also the chairperson of the WHO Digital Health Guidelines. We have heard about an Indian ecosystem architecture being developed. Alain will speak to us how one could translate the digital health guidelines and the implementation frameworks, giving a few examples from really implementation that has happened in some of the low and middle income countries. What does it take for a government and other network partners to work together to actually make this happen? Welcome, Alain.
All right, good afternoon. I think standing between you and lunch, you are the brave souls who get to hear some of this exciting developments that's happening here in India. And I think having a Ministry of Health showing this kind of leadership really sets India apart in terms of the kind of digital health blueprint we just heard about. So let me see if we can get this to work. So we've been asked to speak for about 20 minutes, and I think I want to rephrase what our colleagues from GEO said this morning. There are many Indias, and the India that I've had the privilege of working with for so many years and other countries in South Asia, this is the truth on the ground. In 20 minutes, we will be experiencing 10 maternal deaths, preventable maternal deaths, and 90 newborn babies will lose their lives in this span of time that's entirely preventable. It's a question of access of essential services at the right time, at the right place. And this is not just in India, but across the Gangetic floodplain. India has done dramatically well over the past decades, and we can see how we've gone down from a newborn fatality rate of about 51 to 32, but that remains 10 times higher than the European average. So there's miles to go before we sleep on these essential parts of delivery of primary care in rural populations. When you consider where is this happening on the globe, here is a map of the world where the countries have been inflated based on the relative proportion of mortality that those countries experience. And you can see, unfortunately, India, Bangladesh, Pakistan, and much of sub-Saharan Africa dominate this map. It was here about 4.5 decades ago that I had the privilege of being born, almost a statistic myself, because my mother experienced postpartum sepsis, and I was probably part of the problem because of my big head, resulting in obstructed labor. And at that time, there was no talk of digital health. There was no access to drugs to try and save my mother's life. So it was a great challenge to actually make that happen in the emerging country of Bangladesh. But if you notice, that same map reflected here in the mobile phone revolution is why we are here today, why this distinguished panel and many of you in the audience are thinking about digital health as an opportunity to solve some of these long-standing problems of public health. You see the same countries that are inflating with the mobile phone revolution that have been suffering the greatest burden of maternal and child mortality. So when we talk about remote resource-poor settings, like Adrian talked about this morning, it's being redefined because of this new infrastructure that's available around the world. The last mile is being redefined. Who we can get in touch with, whether it's a client or a frontline provider, is now modified because of that mobile network, because of that mobile technology. But how does this help the overwhelmed workforce? How does this help the disconnected families who are struggling to be in touch with their healthcare worker or to know when they should be taking their children for vaccinations? These are the very simple problems that we're trying to deal with, in addition to improving surgical care, but the basic kinds of public health services that we know can save lives have still not reached the levels of coverage that they should in countries like India, Bangladesh, and across sub-Saharan Africa. We have tried audacious things in a project we've been running in Bangladesh for the past 20 years, giving phones to families to notify us when a birth takes place. And we thought, this won't work. People won't let us know so that we can dispatch a midwife to the home for skilled delivery. But in 90% of the time, thanks to the mobile phone, we were able to get a nurse midwife to be there in the home to assist with the delivery in a context where about 65% of births are still happening outside of facilities. We launched the mCare project with the Ministry of Health and WHO, which demonstrated that by improving supply side and demand side pushes using technology, this is called the WHO Open SRP platform that digitizes the health workers' registers, we were able to triple antenatal care and double postnatal care in this context. We also showed a borderline significant reduction in neonatal mortality from 45 to about 20 in this population. So what you can imagine, if we think about a Boeing 747 filled with new moms and children crashing every 2 weeks, which is the current situation in South Asia, that would be reducing mortality by about 3/4, a substantial impact thanks to mobile technologies. So we live in exciting times, and I think that's really why this India Mobile Congress is such an interesting place, and the fact that we're having this inaugural mHealth session is so important. When the WHO's new DG, Tedros, tweeted a few weeks ago why he sees reasons for optimism in global health, one of the 3 top reasons he provided was digital technologies. And this is from the chief doctor of the world, if you would think of it that way. So in 2018, the World Health Assembly passed a resolution, India was one of the sponsors, recommending the use of digital technologies. And this came out just a few weeks before the Digital Health Blueprint was embarked upon. And that's really what I think is very exciting, to be in this time when the Ministry of Health is providing that level of leadership to provide the standards and the Build 2 guidelines for the private sector and the public sector to be interoperating around a set of standards. Over the past several years, we've developed some vocabulary of how do we speak about digital health. This is the WHO classification of digital health interventions. It's a use of terms because we ask ourselves, is your mHealth the same as my mHealth? If you're referring to something as mHealth and